We make any kind of device that fits onto the body, and that can be anything from a pair of insoles that fit inside somebody's shoes, anything up to like a spinal brace. If somebody's got a spinal injury, we can provide a brace for that, neck bracing, knee bracing, any kind of brace that fits onto the body. We can also do hosiery. When I say hosiery, I mean that's like compression stockings. We prescribe those as well, and also supports for people with hernias. So it really is quite a diverse kind of thing that we do.
As an orthotist, we would assess a patient, come up with a prescription for them, design something. Sometimes it's taking measurements, sometimes it's taking 3D scans, casting, and then we send that off and it gets made into whatever prescription we've requested. Then the patient would come back and we would fit them to them, and then that's when the physios would then take over.
Well, Let's Go Physio, we offer orthotics, and that can be children for provision of anything that could be air falls, it could be spinal supports. We also see adults with neuromuscular problems. That can be anything from a stroke to patients with Parkinson's. We've got a fully equipped gait lab where we can do 2D gait analysis, so we can look at how the patient's walking, and then we can provide them with a device that will modify and help the way that they walk. We also see MSK patients as well, so that can be sports injuries, and that can be anything from a pair of insoles up to supports for the ankle or the knee.
We have a nice big room where we can assess our patients. We've got all the equipment that we need. We have plenty of time with patients, so I like that aspect, and I also like the multidisciplinary team working. So me as an orthotist, a lot of the time in my past careers, you work alone a lot. And it's really nice to have the physios with you, and we can take an MDT approach to treating the patient, and I feel like that is a big impact on the patient.
We have 2 cameras, one set up from the front and one from the side, and we also have a walkway. The system that we have, the Canovia, we can actually slow the walking down when we're actually looking at it on the screen. So we can actually analyse the gait cycle, which comes in different parts. So we can look at the timings of the gait, making sure that the body's doing the right thing at the right time. And we can also analyse the angles. So if we're doing something like a splint, we can finely tune that to the sort of optimal angle for the patient to walk in.
So probably my proudest moment as an orthotist is getting somebody to walk. I've got a couple of ones in mind that I've had where they've had a spinal injury or somebody had a stroke and they hadn't walked for a few years, and then we've added a device to them and got them up and they've actually walked, and then the next time I've seen them they've basically got their life back. They're playing, they're playing golf, he's walking. I mean, I have one client particularly who I always think was probably my proudest moment, and he hadn't walked particularly well for years. Him and his wife came to me to say, they needed something so they could go out and do a little bit more together. And when he came back after we'd give him a pair of what we call AFOs, he was playing golf, he was out shopping, they were going out doing 5-mile walks together, and they got their life back and they were planning holidays and trips. I think that's probably one of my proudest moments.